Hi friends, today we will discuss some points on newborn reflexes. First, what is a reflex? It is an involuntary response to a stimulus. Types include first one is sucking reflex. When the finger or something is introduced into baby's mouth, the baby begins to suck when the area stimulates. This is how sucking reflex happens. It disappears at the age of around 6 months. Next one is rooting reflex. This reflex starts when the corner of the baby's mouth is stroked or touched. The baby will turn their head and open their mouth to follow and root in the direction of the stroking. This helps the baby find a breast or bottle to start feeding. This is rooting reflex and it disappears at the age of 3 to 4 months of age. Next is grasp reflex. Palmar grasp and plantar grasp reflexes are there. First we can see what is palmar grasp. When placing a finger or stroking inside of infant's palm, the hand will close around it. This is known as palmar grasp reflex. It disappears at the age of 4 to 6 months. Next is plantar grasp reflex. When a finger is placed under the toes will curl. This is known as plantar grasp reflex and it disappears at the age of 9 months to 1. Next is moro reflex or startle reflex. When the infant hears sudden loud noise or experiences unexpected movement, the infant will extend the arms with the palms up and then moves the arms back to the body. Sometimes crying is noted afterwards. This is known as moro reflex and it disappears about 6 months. Next is Babinski reflex. When the bottom of the foot is stroked from the heel upward along the outward part of foot, the big toe dorsiflexes and the other toes fanfold or spread out. This is known as Babinski reflex. It disappears about 1 year of age. Next is crawling reflex. When the infant is placed on the stomach and pressure such a hand is applied to the sole of the foot, the infant will attempt to push against the hand and move the arms and legs in a crawling like motion. This is crawling reflex and it disappears few weeks to months after birth. Next one is step reflex. When holding the infant upright with legs and feet touching a surface, the infant will move the legs like taking steps or walking. This is step reflex and it disappears 3 to 4 months of age. Next is tonic neck reflex or fencing. When infant's head is turned to one side, the leg and arm on that side will extend while the leg and arm on the opposite side will flex. This is tonic neck reflex and it disappears at the age of 4 months. Next one is doll's eye reflex. When an object is shown to a newborn, normally eyes don't move but head turns to the right or left side towards the object. This is doll's eye reflex. It disappears at the age of 3 to 4 months. Next is parachute reflex. This reflex occurs in slightly older infants when the child is held upright and the baby's body is rotated quickly to face forward. As in falling, the baby will extend his arm forward as if to break a fall, even though this reflex appears long before the baby walks. This reflex will never disappear. So this is the end of the topic. So thank you for watching.